Hi everybody, welcome back to my channel. Today I wanted to specifically talk to RNs who are over 50 because I wanted to talk about home health being possibly a good choice for us RNs over age 50. A lot of us have been doing, hospital nursing for many years, running up and down those halls, and we may be looking for a change of pace, something that is a little easier on our feet, our backs, and we just maybe just a little change of pace. So I wanted to give my honest opinion and my honest input of a home health nurse who has been doing home health off and on for most of the 24 years I've been a nurse. The good, the bad, and the ugly. So the things that you can expect, honestly, from home health and what it's really like to be a home health nurse. Most people, their experience with home health nursing may have been in nursing school. Maybe if you're like me, I rode with an LPN in nursing school and I thought, oh, I never want to do home health. I mean, that is just not for me. And wouldn't you know, that's what I ended up in. But maybe you have never gotten to try home health. Maybe you've never really thought about home health. But as you get closer to, mid 50s, late 50s, 60, you're starting to think, how long am I going to be able to keep up with these 12-hour shifts and running up and down these halls and moving patients and all? Well, home health is definitely a change of pace. So it is something to consider when you're trying to avoid that kind of stress on your body. So the first thing I guess the first place to start is why you might want to try home health. So like I just said, some of the stress on your body, the hospital politics that, we're all familiar with in the hospital. Home health, you're working very independently. You may go into the office once a week for an hour, if that, just to pick up supplies. Some companies have they have like a case conference once a week, so you may go to that. While you're there at the case conference, you pick up some supplies you need. But other than that, you're really working independently, which is a plus if you have a lot of experience and you can, you feel comfortable taking care of patients and your assessment skills, but a negative if you don't feel comfortable that way. If you're a newer nurse, that's why generally you need to be a nurse for at least 1 or 2 years and have good, lab skills, that kind of thing, assessment skills before you come out here in the field, because there's nobody who's going to be able to, take a look at the patient and let you know what they think. If you don't know, your next backup is EMS. So, that's kind of the pluses and minuses of working independently. But most of us older nurses, we've been nurses a long time. We're totally comfortable in that environment. And speaking of environments, that's a second pro and con. So the pro of working with patients in the home is that you are in their environment. So you get to see the other side of what they're experiencing and going through, and how they're managing their diabetes or their heart failure. Your job as a home health nurse is to hopefully keep them out of the hospital. Okay. So you're teaching them a lot of tips and tricks, daily weights, low sodium diets, counting carbs, those kind of things to keep them out of the hospital. That's kind of your focus. And you do get involved with some of the things, say, for instance, working with the family to help people to get the care they need. Say, a very common problem that I encounter all the time is that the patient needs more care than the family can provide. So you, as the home health nurse, are helping them to get community resources, get hooked up with like social workers, get Meals on Wheels, stuff like that. You're a little bit of a social worker sometimes. Calling the doctor, getting some orders that may be needed for them to live independently, maybe getting a shower chair ordered, things like that. So that is a positive of working with them. It's a lot of teaching, which most of us nurses love. We love teaching. I do, and helping people to understand their disease process. You don't get a lot of time in the hospital to do that. You're just giving the instructions. Here, take these medicines. In home health, you're teaching them how to take the medicines. You're teaching them what side effects to look for with the medicines. You're making sure they have the medicines. You're making sure that they have enough of their medicines. Stuff like that, and calling the doctor because, here on the paper it says that they're supposed to be taking, atorvastatin, but they don't have any atorvastatin. That's just an example. But, making sure that sometimes we fill up the med planner. We're not really supposed to do that as much as we used to. We used to go in and fill up everybody's med planner, but we don't really do that. Insurance companies want the patient or the family. So your job in the home is to get the family involved to fill up the med planners and to give the medications, or if the patient can't remember to take their medicine, a lot of them can't. They can't remember. They've got, they're 90. Get the family involved and get them calling the patient so that they remember to take their medicines. So that's kind of an exciting part of it. It's a lot of teaching, and instead of just teaching, here, this is, take your insulin. You're teaching, well, this is your long acting, this is your short acting, this is when you should check your blood sugar, this is what your blood sugar should be, this is, those kind of things. You're getting the idea. So, but the negative is you are in the patient's home, and in their home, they may have cats. You may be allergic to cats. They may have a beautiful, expensive, amazing house with, beautiful artwork everywhere, and they may be hoarders, and they may have roaches crawling up the wall. So I learned a long time ago, not to judge people. You don't judge them for their house. That's not what you're there for. You're there to give care and to teach them how to stay in their house, because if they're in their right mind, and they generally are, or their family, they want to be in their home, and that's where they want to be. So even if they, have a dirty home, it's not our job to judge them about that. So another wonderful thing about home health is the shifts. I mean, we do 5 8-hour shifts generally. It's very flexible. So some patients won't let you come at 8 o'clock. Most of them won't. Some of them you have to come at 10 o'clock. And sometimes you have to start your first patient at 10 o'clock. But it gives you flexibility because you start at 8, you call everybody, you get your schedule, and then you have time to stop at the grocery store and pick up, dog food, because you're driving around all day. It's not like you're going to go in the hospital when it's dark outside and then you come out when it's dark. You're not missing days like you do when you work in the hospital. You're out here and you can stop and do whatever you want to do during the day. If you need to go to the dentist, you just make a break in your schedule. You go get your teeth cleaned or whatever, and then you pick it up and you just work a little later that night. So, so that's a big positive as far as weekends. We generally don't work on the weekends, and we don't generally work on holidays. The office is closed. There are some agencies do have a call where you have to take, call once every 6 weeks or something. And what that generally entails is you answer the phone if any patients call between the hours of 8 and 8 p.m. and or 5 p.m. and 8 a.m. So usually we used to go out at night and see patients. And I have some horror stories about going out in the middle of the night and driving through the mountains in Tennessee and going through the moonshine country, and yeah, I have some stories about that, but we don't generally do that anymore just for safety reasons. It's not life and death, and we are not an emergency service. So home health is not an emergency service. If they needed it, if they need something, sorry, little break there. My dog started barking. So like I was saying, we are not an emergency service. So if the patient is having signs of a stroke or their blood sugar is too low, we don't get in our car and run over there. Our job is to teach them on our previous visit what to do if their blood sugar is too low and when it is too low and the symptoms of a stroke and what to do and the family and all that. But they don't, I'm generally, sometimes I have had them call me and I have sent them straight to the hospital because they really were in some kind of distress. And a lot of times, though, you've already taught them. We give them handouts about when to call us and when to call 911. So when you're doing your call, you're generally not going out. Now, sometimes you may work and do some admissions on the weekends. A lot of the larger agencies, because now everything's owned by corporations, and those big agencies hire nurses that work on the weekends, and they're expecting to work on the weekend, and so the on-call nurse isn't really doing that. Some do, but most of the time, no. So that's a big positive for us nurses who've been in the hospital and worked in the hospital. The politics we're not dealing with all that politics in the office because we're working independent. The tech, this tech's not doing their job and giving us, this nurse hates us and we hate this person, and none of that's happening because you're working independently. So you get rid of all that. So that's really good. Let's see. Those are some of the main things that I feel are the positives. Now, here's the negatives. Okay, this is the straight up negatives. The number one is, I would say, the driving. There's a lot of driving. Some agencies you don't drive that much. Because I do home health travel, so I work for a lot of different agencies, and sometimes I don't drive that much. I'll stay in a city area, and I might drive 30 or 40 miles a day. Okay. But some agencies and some positions are more rural, like the one I'm working in now, where I'm covering a large area south of Fort Worth. And so I'm driving, on a good day, I'm driving 50 miles. On an average day, I'd say 80 to 100. And I have, not with this contract, but I have driven averaging probably over 100 for agencies. So when you're shopping for an agency, if you're shopping for a home health job, ask that question: how much driving am I going to do now? They do pay you for your mileage, and it seems like you make money up front because I think they're paying, some agencies are still paying like 45 cents a mile, which at $4 a gallon gas and the price of cars, that's low. The GSA rate, I think, is like 65. And I feel like that's what if I remember my contract, that's what I'm making, 65 cents a mile. But the regular nurses here, I think they're making like 60 cents a mile. So it looks like you're making some money, especially if you have the right car with good gas mileage and all that. So, so you know, if you like driving and that's a time for you to listen to your favorite podcast and you want to, you know, talk on the phone or, you know, listen to whatever you want on the radio and just kind of unwind, it's perfect for you. You know, get one of these jobs where you're working in the rural areas. I love working rural areas. I'll be honest, I really love it. But if driving's not for you, then you don't want to look at working in a rural area. You want to be more in a city. And if you don't like driving at all, well, maybe home health isn't really for you because that's how you get to the patient's house. So some agencies are going back to giving the nurses cars. That's coming back. It used to be common, and then they kind of did away with it completely. But I think some places are coming back to that. So you could always ask that question. But if they give you a car, then they also aren't paying you mileage. And you do, with the right car, you can make a little money on your mileage. Think about that. So that is one of them. The second negative, and I'm not sure if I've got this in the right order, maybe I switched it, but the big negative is the documentation time. So let me explain to you how this works, okay? I'm being as brief with it as I can, but just so you understand. So when you sign up with an agency, they're usually going to tell you what their productivity points are. They have a point system that they use to schedule you. And so I'll use this agency I'm working for as an example. So their full-time points are 30 points a week, 30 points. So with an admission, that's 2.5 points. Like a discharge, I think it's like 1 point. A visit is 1 point. But all agencies are different. I promise you that they're different. And some agencies will give you a point if you drive over 50 miles. This agency, they'll give you a point if you drive over 100 miles. So think about that. That's an hour and a half of your time. But so anyway, they're going to schedule you based on those points. And some are more strict about that than others. Some of them are very lenient. They know that the points, because to be completely honest, the points don't really match up to the time it takes you to do your work, usually. Unless you're really fast, like me, or somebody who's got a lot of experience. So they give you 2.5 points to do an admission. Let's think about that. And so that's 2.5 points equals, you know, about 2.5 hours, they're thinking, because then you've got the drive time, which you might drive 45 minutes to get to that patient's house and 45 minutes to the next patient's house. And then, so I would say maybe an hour and a half in the home, and then probably, you know, maybe at the most a half hour of documentation at home. So now you're at 2 hours and 45 minutes. You got to call the doctor, but that's for an easy patient. Some patients are harder, and sometimes people end up having to do a lot of documentation that takes them longer than 40 hours, and they signed up for their 40-hour a week. You know, they're thinking, you know, I'm going to work 8 to 4:30, and they're actually not. By the time they get all their stuff done, there's calls for the next day. You know, they're working not 8 hours a day, they're working 10 hours a day or 9 hours a day. That can happen to you. So, you know, the thing about home health is you have to be fast and accurate. And if you're a seasoned, experienced nurse, you have great assessment skills. So you already have that in the bag. You know what you're kind of doing. And once you get going, you can get faster. There's something called an OASIS, which is a government Medicare assessment tool. which is a big mess, but it's been here since I started, back in, 2002. They first came out with it around that time. But basically, it's this long form that they spend a lot of time teaching the nurse how to fill out. And because the company's reimbursement is tied to your answers. So if you make it's tricky, and I'm not going to go into all that. I could do a whole video on the OASIS, but you're putting what the patient is safe to do, not what they can do. And so the bad news is that sometimes it's hard to answer those questions accurately while you're in the home, and you need to get this done mostly in the home so that you're not charting till 9 o'clock. But the good news is they have a QR team. So every agency now has this. They go over your OASIS, and somebody's going to say, well, if the patient, needs a walker, then they obviously, it can't go up 12 steps safely. And they'll change that answer if you put that answer. So things like that. You work as a team with them, but it does take time, and you do have to learn it. So if you wanted to try home health, you just expect, a learning curve there with the OASIS, and don't take if they change your answers, say thank you, because if it's something you totally don't agree with, you don't have to agree with it. You can sign that you don't agree with it, but they're helping you by making your answers consistent. So it's actually a team effort to get these OASIS done. And like I said, they are tied to reimbursement. So they're not just an assessment tool, they're a payment tool. And they will spend some time teaching you that OASIS. And I would say that's the biggest negative to home health, and why everybody just can't walk into home health and do the job. You have to know how to do that OASIS, okay? And it's, like I said, it's paperwork. So if you are, over 50, you're going to be spending your time doing paperwork in your living room with your feet up, rather than, running down the hall, standing in the patient's room, typing on the computer and all that, okay? So you just have to make sure, pro tip, finish your paperwork the same day. Don't hold it over till the next day. Make sure you get it done. So so that's really the two biggest negatives. I would say another positive is the pay. Honestly, I think you make more money in home health than you do in working in a hospital, I think. And I do traveling home health. And the reason I do traveling is because traveling home health is because the rates are a little bit better than if I were going to go do ER or med surge and all that. And I don't want to kill myself lifting patients and scooting patients and helping them in. You don't do any of that stuff in home health. The patients, are in their own environment, and you do not do that. I mean, if the family's there, if they need help, the family helps them. I mean, I'm always happy to, lend a hand, but the truth is however they normally do it, that's how, when I'm there, they do it. So, I mean, yeah. So is home health easier than hospital nursing? Yes and no. It is easier on your body. It is easier on your body. It is easier on your family life. Because even if you have young children, if you're not over 50 and you still have kids at home, well, that's what I did when my kids were at home. I literally, dropped my kids off in the morning, went and saw patients, and then came back, picked them up from school, and then documented everything at night, after I fed them and got them in their, pajamas or whatever. So that's a great thing. Flexibility, family life. I sat at many ball games and did my finished my OASIS and my documentation while my kids were playing Little League. So, I mean, that's another thing you can do. Yeah. So my advice is give it a try. You know, don't let your age stop you. I mean, sometimes people feel like, you know, well, I can't do anything else. I've been doing, you know, working in med surg. I've been doing surgery or whatever for all these years, and I can't really make a change. Well, baloney. You can. You can try home health. They need home health nurses. That's why I'm traveling. There's probably 1,000 empty home health travel positions open, and that's because there's no home health nurses. It's hard to get them. You just can't hire new grads. You have to have experienced nurses. You have to have people with confidence. And so my advice is to give it a try. If you don't like it, you can go back to hospital nursing. I mean, you think they're not going to hire you? Of course they're going to hire you. They're probably not going to be able to replace you after you leave. You know, don't let it stop you, especially if you're curious and you think that it's something that you've always wanted to try, or you know, just never have tried. You know, go for it. I mean, and my final thoughts about it are that it's worth exploring. It's worth trying, and you know, some of the best things in life are the things that made you nervous and you did it anyway. You pushed through it. So, yeah, if you want, you can probably try it PR. Oh, that's what I wanted to say about it. So I didn't want to leave this out. This was very important. So as we get older, it gets, you know, when you're 62, 63, 65, whatever, maybe you're getting your Social Security. It's going to be hard to be working in the ER at that age, right? Or standing on your feet for 8 hours, all that stuff. Well, home health, you're not standing on your feet. And if you get in the door now, you can do PRN. So in other words, and this is my plan, whenever I just need some extra money, I can just have an agency that I work, you know, I go see 2 or 3 patients on Tuesday, 2 or 3 patients on Wednesday, and then, you know, 2 or 3 patients on Friday or less. They will work with you because they need help. And if they know that, you know, you're available on Monday and Friday, then they will, you know, schedule you that way. It's not like, you know, they don't need you. They do. So they'll let you go do an admission. They'll let you, you know, just go see regular patients. They will work with you. I've never worked with an agency. I never have. And I've worked with a lot of agencies. I have to sit down and count one day how many agencies I worked for. A lot. I've never had one that wouldn't work with you because they, especially people that are kind of semi-retired, they love those nurses because they're good nurses, but they just aren't able to, you know, run up and down the halls all day, you know, for 12 hours a day or even 8 hours a day. You know, you got a bad back, you can't, you know, lift patients. In home health, you're not lifting any patients. So that's another good reason to give it a chance. I guess I'm the home health salesperson for today. It's just because I have, you know, gotten so much out of it. I've learned so much from patients. I've learned more from the patients than they've probably learned from me. And that's why I just think that it might be the icing on the cake for some of you guys. So anyway, if you find that any of my suggestions or my thoughts have been helpful, just put it in the comments and let me know. If you have further questions or anything like that, just let me know. I'll answer those questions. Give me a thumbs up, like and subscribe if you can, and let me know what you want to know more about. Like I said, I am a home health travel nurse, so I have talked about traveling. And I probably will talk more about traveling. So, you know, follow along and kind of come along on the journey, and we'll see where we end up. Thanks for watching, and I'll see you on the next video.